Hello, everybody. Thank you for listening to My City Talks. This is the podcast powered by My City, My Health and the My City, My Health Conference. Today, I have a great and exciting guest with me. If you have heard the conversation we had already before we, then you would be just as excited as I am. I have Dr. Gregory Johnson here today. Dr. Johnson, thank you so much for being on the podcast and being a speaker at this year's My City, My Health.
Thank you for the invitation. I'm excited to do this, and I'm excited to be a panelist.
Yeah, so before we get into, because you're on the Black Men's Health panel,
Yeah.
and I definitely have some questions about that for you. But I want the people to know a little bit about you, your past and what got you to Des Moines.
Yeah, so it's a great question. This is the beginning of year 2 for me in Des Moines.
Okay.
I came from Houston, Texas, where I previously was the Chief Executive Officer and Chief Health Equity and Diversity Officer for a national multi-specialty medical group focused on the hospital space.
Right.
And if people want to know my background and everything else, I'll give the short version, which is that I'm originally from Austin, Texas. I was raised there. I'm a doctor's kid. Most people automatically go, oh, well, that means that you knew you were going to be a doctor. Nope, actually. It looked like he worked really hard.
Right.
And I didn't see him that much. And so I was like, this looks, let's figure it out. But late in my college career, I went and I was just like, I don't really know what I'm going to do yet. And I spent some time at the VA hospital in Houston. Saw a patient with a terrible, terrible wound. He had a spinal cord patient. He had a terrible infection that had really caused a giant ulcer in his back. It was one of the most horrific things you could see. And I remember turning to the physician at the time as a pre-med student, really not even a pre-med student, just somebody who was thinking about it. And I was like, that doesn't look like he's going to live. And he said, no. If he didn't come here, he wouldn't. But here are the things we're going to do to be able to help him. And here's your process. And it was 6 weeks of digging into what is dead tissue and just helping to clean the wound. But I watched over the course of that 6 weeks, not only the wound heal, but his relationship with his family heal, with the relationship with how the entire care team was there to lift him up. And by the end of the 6 weeks, I was like, well, if this is what medicine is, I got to do this. Went to medical school in Houston and then residency. I did a dual residency in both internal medicine and family medicine at the Ochsner Clinic in New Orleans, and then went into private practice, did all that good stuff. But then I very quickly identified that, unsurprisingly, there are financial incentives that are completely opposite in medicine that are completely opposite from what we need to do for patients. And I kept sitting there going, something's not right. Maybe I don't know anything, don't know enough. So I spent some time in business school and was like, okay, well, let me dig in and figure out, because people say follow the money. So I
Follow the money.
and tried to figure it out. Eventually got into balancing both administrative and clinical leadership, and then kept advancing there because I kept saying, well, I've taken care of excellent job of 25 patients a day at the bedside. Well, and then I became a medical director. Okay, now I'm taking care of a couple hundred. Now I became a regional medical director in thousands. And I was like, how do you take what you think health care should be to populations of patients? So they call it population health. This was before it became a catchphrase. And I was like, I want to heal. I'm a healer. I want to help heal people and populations. And eventually got into administrative medicine. And 15 years with my prior group, things were going well. Kids were happy, everything else. But I wanted to be closer to a community because my group was always contracted through hospitals. And I wanted to get a little closer. And so ultimately, I started looking for jobs. Happened to get a phone call saying, have you considered Iowa? Des Moines. And I was like, I've been there. I actually hadn't been to Des Moines. I'd been to Cedar Rapids. I'd been actually to Mason City.
Okay.
Never been to Des Moines. And I said, if I'm being true to myself, this is one of the biggest opportunities, because to get in and do exactly what I believe I've been put here on this earth to do, which is to help improve people's lives through healthcare.
Right.